Hello, my name is Tamika Tadzi, here to do a presentation on health promotion, health studies. The topic that I'm going to focus on is Eat Smart, Feel Better. Introduction to health promotion. Health promotion is a key role in improving individual and community well-being, especially in line with NHS public health goals. I'll look at the key models that guide behavior change and how they shape real-life health initiatives. I'll also introduce a campaign, Eat Smart, Feel Better, which promotes health eating among young adults and supports future NHS health promotion strategies. Why health promotion matters, or in other words, why health promotion is important. Health promotion is crucial because it helps prevent diseases which can significantly reduce healthcare costs. It targets preventable risk factors like smoking and physical inactivity. Additionally, health promotion efforts can reduce disparities among different populations, making healthcare more equitable. Ultimately, it empowers people to take control of their health and make informed choices. What are health promotion models? So these are frameworks that guide the development of strategies to improve health. They also help us understand how to influence both individual behaviors and community norms. These models give structure to campaigns, ensuring interventions are targeted and effective. Biomedical model. The biomedical model focuses on diagnosing and treating diseases, aiming to eliminate illnesses. Its main emphasis is on the absence of disease rather than prevention. While it's important, it's limited because it doesn't address lifestyle or social determinants of health. Behavior change model. This model centers on changing individual habits like quitting smoking or eating healthier. It promotes personal responsibility for health. Campaigns such as smoking cessation programs are good examples of this approach. There's just an illustration of people trying to lead a health lifestyle by engaging in exercise. Socio-ecological model. This model recognizes that health outcomes are shaped by multiple levels: individual, interpersonal, community, and policy. It aims to address social and structural barriers and that influence health behaviors. It's a holistic approach, acknowledging that environment and social context matter just as much as personal choice. Health belief model. This one explains the actions that people are more likely to change behavior if they perceive a risk of severity related to health issues. What that means is that people are more willing to change behavior if there is an incentive towards that change of behavior. It also considers perceived barriers and benefits. For example, someone might quit smoking if they believe it will significantly reduce their risk of having lung cancer as a result of that smoking. Tannehill model. The Tannehill model integrates three key areas, which are health protection, health education, and disease prevention. It promotes a comprehensive approach combining education policy and direct intervention. It also emphasizes that effective health promotion requires overlap and synergy between these areas. Stages of change model. So behavior is not an instant. Behavior change is not instant. It's a process. So a person, before they change their behavior, they have to go through certain processes, like they'll go through pre-contemplation, then they contemplate, then they start preparing for the behavior change, then they'll start acting on it. Then the last part is where then they have to maintain that behavior. So by going through that stages, it enforces that change of behavior. And understanding this helps to us tailor interventions to where someone is in their journey with that change of behavior. Comparison: behavior change versus socio-ecological. Behavior change model focuses mainly on individuals and cost effectiveness. However, it might overlook social and environmental factors influencing that change of behavior. Socio-ecological model addresses multiple layers, like individual social policy for a more holistic and sustainable impact. Long-term change requires tackling system barriers. Evaluating model effectiveness. Behavior change model. The advantages of behavior change model is that it is effective. It is effective in the short term for individual actions. While the disadvantage is that it overlooks social, economic, and environmental influences. Socio-ecological model. The socio-ecological model has mainly got advantages. They promote long-term sustainable change. They also address health inequalities by targeting broader social factors. Eat smart, feel better. Okay. This campaign specifically targets young adults, mainly aged between 18 to 25. It aims to improve dietary habits that are often poor during student life. Their goal is not just physical health, but also mental well-being. There's an illustration of a young person trying to adapt to eating healthy meals. Objectives of this campaign. To help raise awareness of the NHS, it will guides. It reduces processed, fatty, and sugary foods. So that means by adapting this model, it helps a person adapt to certain things, like certain foods that are bad, like like it says here, sugary stuff, fatty, and overall bad foods. A promotion of affordable home cooking. So it promotes affordable home cooking. It shares content through posters and social media, making it available to the larger audience. There's an illustration of a group of people engaging in trying to make a healthy meal. Models used in the campaign. The behavior, the health belief model helps to focus on perceived risks. Risks and benefits to motivate change. The behavior change model guides our motivation strategies like themed days such as Meal Prep Monday to encourage regular health lifestyles. Effectiveness of the initiative. Since the launch, there's been like 58% of people cooking more health meals. There was a 65% percentage of people who reduced in eating sugary snacks. Nutrition knowledge improved by 75%, showing increased awareness. Participants also enjoyed sharing their recipes, making it more engaging. Challenges and feedback. Though this model was successful, but it had its own setbacks, and there was a feedback after the model was introduced. So the feedback was some barriers included lack of confidence and time for cooking. The participants expressed a desire for more practical cooking sessions. Long-term support and addressing of social factors are essential for sustained long success. Contribution to public health. So this campaign addresses major issues like obesity and poor nutrition, which are linked to chronic diseases. It aligns with NHS priorities, promoting prevention over the treatment. It also emphasizes accessible education for everyone. The NHS contribution to public health. The campaign addresses major issues like obesity and nutrition, which are linked to chronic diseases. Vaccination programs, including its preventative services. Vaccination programs include COVID-19, flu, and other immunizations to prevent disease spread. Cancer screenings, regular screening programs such as cervical cancer, breast cancer, and bowel cancer screenings facilitate early detection and improve treatment outcomes. Public health campaigns. Challenge for Life aims to promote healthier lifestyles, including diet and exercise. NHS Smoke-Free supports smoking cessation efforts and reduces tobacco-related health issues. Its collaborations. It works well with other local authorities to implement health promotion initiatives and prevent diseases at community levels. Key successes of the NHS. Since its inception, the NHS has got its own successes. Some of these are improved life expectancy, early detection of and effective treatment that have contributed to increase in average lifespan. Disease prevention. High vaccination rates have significantly reduced the prevalence of communicable diseases. It promotes health. Campaigns like Change for Life and NHS Smoke Free effectively raise public awareness. These initiatives influence healthier behaviors and lifestyles. Health equity. The NHS strives to produce equitable care regardless of socio-economic background, ensuring vulnerable populations receive necessary services. Barriers to success. So even though it's NHS has got success rates, but it has also its negatives. So the barriers to success are the funding and staffing challenges. Mainly the NHS face this because they are overloaded with work, and therefore it's also underfunded, causing long waiting times and overstretched services. Service fragmentation. Disconnected health and social care systems hinder seamless patients' care. Persistent health inequalities. Deprived communities still face barriers to access and waste health outcomes. Social determinants of health. Factors like poverty, poor housing, and social deprivation remains difficult to address fully within the NHS framework. Overall evaluation of NHS. The strengths are the NHS is a fundamental pillar of public health, emphasizing prevention, equitable access, and health promotion. Its limitations are the universal model is effective but faces structural challenges such as funding constraints and workforce shortages. Need to reform. There's a need to reform because of all these negative things. To realize the full potential, NHS requires reforms focused on increasing funding, workforce planning, and barrier integration of health and social care services. Tackling inequalities and enabling community health. The NHS main commitment is to reduce health discrimination, especially in undeserved communities. It works closely with Marmot Review for its support. NHS is like an enabler for its support of grassroots initiatives like Eat Smart, Feel Better, extending their impact through funding. There is an illustration of the impact that NHS has had on the communities. A unified approach to public health. Both the NHS and its programs have contributed to better healthcare appropriation, reducing health inequalities. They focus on low-income youths and students. It increases peer-led content engagement, supports empowerment of nutrition, budget-friendly resources. In conclusion, we can see that NHS needs a reform despite it being successful. So even though it's successful, it still needs a lot of work so that it functions fully. Together with Eat Smart, Eat Smart, Feel Better aligns with NHS priorities by delivering measurable improvements and awareness and diet. It encourages long-term barriers. So together they highlight the power of combining these projects together, these campaigns together. Anyway, that brings me to the end of my presentation. I hope you have enjoyed it. Thank you.